All right. So, hi, my name is Sarah. I'm a student physical therapist assistant. So, before I start, I would like to ask if any one of you have any difficulty performing daily tasks. For example, bending over to pick up an item, squatting down, doing your gardening job, or lifting heavy objects, or simply just scratching your back. And for those of you, okay, who are playing sports, do you feel like you aren't performing as well as before? Let me just admit someone in. All right. So for those of you who play sports, do you feel that you aren't performing as well as before because of the recent pain that you have or even previous injuries? All right. So in this workshop, I'm going to talk about why we are having this problem and what we can do about it. So it actually all comes down to having proper functional movement. So I hope that you all stay till the end because we are offering a special offer, which is really rare for us to give it out. Okay? And we only have limited spots, so definitely stay till the end. All right. So as I mentioned, it all comes down to the basic, which is functional movement. So what exactly is functional movement? Well, it is the basic movement pattern that involve various body parts and are integrated in everyday activities. So for example, sitting down to a chair, squatting down to pick up an item, reaching to a high cabinet, or walking, pushing, or pulling an item. So what do we need in order to have proper functional movement? And why is it important? Well, functional movement actually involves three main things: proper mobility, motor control, and strength. So if one part of that, those three key stuff is not working properly, our body does not function optimally. So basically our body gonna start compensating in a certain way. So when we start compensating more and more often, we're gonna develop poor movement pattern and eventually lead to poor biomechanics, and worst case scenarios is going to lead to injuries, and that's something that we don't want to see, right? And I believe for the past few months, like some of you have been staying home due to the quarantine and probably spending more time sitting on the chair, sitting on the couch, in front of the computer, probably not being as active as before since the gyms are right now, some of them are still closed and sports are not as active right now. So in that whole time period, since we're sitting down so often, our muscles are going to get tighter and tighter, right? When we're sitting in that certain position. So hopefully you guys have been doing some stretches. And our muscles are actually going to start decreasing too because we're not being active. In fact, there's a research saying that without exercising or being active for more than 2 weeks, our muscle mass and our strength start to decrease. So as you can see, for the past few months, some of us are probably losing some mobility and strength. And since we aren't moving that much, our motor control can also decrease too. And that's pretty scary because for those of you who are trying to go back to sports or trying to be active again, we are more likely to injure ourselves again without having those proper three key things: mobility, motor control, and strength. All right, so now I'm gonna give you guys an example. So for the older population, statistics have shown that we often decrease mobility, motor control, and strength. So again, these three key things. So what would happen if these start to decrease? Well, as you can see from the chart, it says increase fall risk. So how does that even increase fall risks? I'm gonna give you an example. So as we age, we can see that our body, our trunk and our head is leaning forward more, right? We're like bending down a lot more. Our trunk and our shoulders moving forward. That is because our back strength, the muscles at our back is not strong enough to support ourselves upright. And same thing when we go when we walk too. For older people, you can see that they are taking smaller and smaller steps. And why is that? Well, that's because they are decreasing in their mobility of their hip, knee, or even ankle. So with those taken into consideration, you have smaller steps and your body is leaning forward. You can see that you're gonna more likely to fall, right? But what's so scary about falling? Well, for older population, when we fall, there is a high chance of having hip fracture. And hip fractures is actually really scary. I'm gonna tell you a statistic. Apparently, for older population, if they have hip fracture, they are 3 to 4 times more likely to die within a year after the hip surgery compared to the general population. And that is pretty scary, right? And as you can see from the slide, it said every 20 minutes, an older adult dies from a fall in the United States. Again, that's a really high amount of people every 20 minutes. So we definitely have to work on our mobility, motor control, and strength. All right, so now let's look at an example of an athlete. All right, so we might think that athletes, they have more muscle mass, they're stronger, but does that mean that they are less prone to injury when they're playing sports? Well, not necessarily. And I'm talking about injury as in like, not the one that you tackle people down the field, but like they injure by themselves. So as you can see from the slides, it says that athletes and sports competitors suffer more than 2,000 injuries per 10,000 workers. And that is actually a lot compared to the general population. And as you can see from this video, this basketball player is actually suffering some pain at the right lower leg and the ankle region. So he's actually suffering, so he actually tore his Achilles tendon. So let's watch this again. Yep. So you can see on his right foot, when he planted it, he was stretching and contracting that calf muscles at the same time. So putting a lot of stress. And when he pushed off, you can see right now, it actually ruptured. So how does that happen? Well, research has shown that this Achilles tendon is usually caused by poor mechanisms and tightness, too much tightness at the calf muscles. So when your calf muscles are too tight, it will cause pronation of your foot, meaning that your foot, we're gonna start roll inward. So on our foot we have this arch, right? And when it starts rolling inward, it's gonna flatten out the arch here. So basically, you're putting a lot of stress on that Achilles tendon, which is attached with the calf muscles. And this incident doesn't just happen like all at once. It actually happened gradually. You're putting more and more stress due to poor biomechanics and inflexibility of that muscle. And also, you might have some strength imbalances throughout your body, causing that poor biomechanism when you're playing basketball. So that's something that we need to be careful of, having the proper mobility, motor control, and strength. So right now, let's look at an example of our previous patient. So she used to be an active runner, but all of a sudden she started having low back pain. So when she came to us, we assessed her thoroughly, and we realized that she's lacking hip strength, so around the glutes, right? And she also lacked mobility at her hips and lumbar spine. So for our physical therapy session, we provide her manual therapy, exercises, and stretches. And we also teach her the proper way to run, the proper biomechanics of running, okay? So at home, she's also doing some exercises and stretches, which we taught her during the treatment session too. All right, so at the end of the treatment, the whole physical therapy session, she actually has no more pain. So she's actually able to go back to running as she were and with the proper form, which is really good. All right, so if athlete or anyone who plays sport is able to get down the functional movement down properly, as I mentioned earlier, it actually increases the performance, allowing them to run faster or even jump higher or even score like a better, score better in the game. So after hearing all these like potential injuries, I hope you guys are kind of aware like that we need to have that proper functional movement and why that's so important to us. So we're gonna start with some stretches. So if you guys have any mats on the floor, you can actually do it with me. Okay. All right. So for the first one, we're gonna stretch our calf. So it is really important, as you saw from the video that I showed earlier, that it is important to stretch our calf, right? And everyday life, we actually still need that ankle mobility. If the calf is tight, our ankle is going to be stiff. It's not going to be able to move in a certain direction. And we need ankle mobility when we walk, when we run, when we do basically everything, even bending down too. All right, so I'm going to show you guys how to do a calf stretch. Give me a second. All right, so if you guys can do it with me, that will be good. All right, so we're going to start. We're going to find a wall here. We're going to put our hand here. And then we're gonna, the one on the back is the one that we're gonna stretch. So the calf muscle is here. All right, so we're gonna straighten that back knee. And then we're gonna kind of lean forward towards the wall until you feel that stretch at your calf. Okay, I'm gonna hold it for 30 seconds. So I would recommend all of you to do 3 sets of 30 seconds at home. Okay, let's make sure you guys can all see my leg. Okay, so you can see right now my knee is straight and we're gonna stretch the whole calf muscle here. Okay. And make sure your toes are pointing forward. And the next one is still the calf muscle, but it's the other one called the soleus. We're gonna stretch this part, so the lower end here. So it's the same motion, but we're gonna bend the back knee a little bit. We're gonna bend a little bit. So you actually feel it more at the bottom. And again, we're gonna hold it for 30 seconds. And make sure when you're doing this stretch, you're not feeling any pain, okay? Now hold it here. And when you do it, make sure you do it on both legs too. So this one is the first stretch where your knee is straight. Second one, your knee is gonna be slightly bent until you feel that stretch at your lower calf muscle, okay? All right. Now, let's move on to the next one. The next one is hamstring stretch. So hamstring, again, is really important. We've been sitting down most of the time, right? So our hamstring are gonna be tight. So this is the hamstring here, the posterior, the back side of our thigh, okay, this one. So we definitely need to stretch it out. If you don't have proper flexibility of your hamstring, it can actually affect when you're walking. You're not able to take a longer stride, and even running or jogging, or people who play sports too. You don't want to have too tight of your hamstring, or it can cause hamstring strain. All right, so let me show you this one. All right. So make sure you have a stable chair, okay? All right. So I'm gonna stretch my left leg first. Okay, so I'm gonna make sure you kind of straighten your knee out, but you don't have to bring it out fully. So I'm gonna make sure your foot is down on the floor first. Okay, so this is the one I'm trying to stretch. All right, I'm gonna kind of put my hand lightly on my thigh. Okay, and I make sure I'm gonna bend towards my hip here. So I'm gonna bend at my waist and my hip. I'm gonna put my hands here, and I'm gonna bend forward until you feel the stretch in your thigh right here. Okay. Again, we're gonna hold it for 30 seconds. And make sure you have a stable chair, not like mine that can wheel off. right? We're gonna hold it here. Make sure your chest is open. You can kind of arch your back a little bit more here so you can feel more of the stretch back. All right. And for those of you who don't feel a stretch, you can actually straighten your knees out a little bit more. Okay? Same thing. You're gonna lean forward until you feel the stretch here. Make sure your chest is open. You're not rounding your back like that. Okay? Same thing goes for the other side. So same thing. I'm gonna straighten this knee out a little bit. Rotate your trunk over towards this leg. Bend down on your waist so you feel that stretch over here. Okay. All right. So now I'm gonna show you the next one, which is the hip flexor stretch. So this one also, when we've been sitting down way too often, it can be tight too. And for those people who have back pain, usually it's caused by tight hip flexors. So tight hip flexors are the muscle that runs from here to here. All right, so now I'm gonna show you how we're gonna do this. Right. So make sure you have like a mat on the floor. Right. So hip flexor stretch. So I'm gonna stretch the muscle over here. Okay. So I'm gonna be in a kneeling position. Okay. And then make sure we kind of tighten our core. So I'm gonna kind of tuck your belly button in, back, and then we're gonna make sure we tuck our tailbone down. So instead of overarching your back like this, we're gonna tuck it down like this. And then we're gonna bring our pelvis forward. We're gonna shift it forward until you feel a stretch here. Again, it shouldn't be painful, it should just be like a moderate stretch. We're gonna hold it for 30 seconds here. All right. So same thing for the other side. Okay. So this is the right side that I'm stretching right now. So same thing. Tuck your belly button in, tighten your core, tuck your tailbone down instead of arching your back. And then just shift your pelvis forward, shift your hip forward until you feel that stretch. Okay. Again, I would recommend all of you to do that every other day, 3 sets of 30 seconds. All right, now let's go back to the slide. So now we're gonna do some exercises that can help with motor control. So what exactly is motor control? Well, motor control is the ability to produce control movement through coordinated muscle activities. So without proper motor control, the coordination, timing, and symmetry of the movement would be off. So therefore, a dysfunction can happen, and in the long run, it can cause injuries. So what is causing poor motor control? Well, research has shown that being in a non-active lifestyle, so basically you're sitting too much, not being active, or you have previous injuries, or even hypermobility, meaning that you're way too flexible that your body is unable to stabilize itself or moving in a coordinated way. Okay, so now we're gonna do an exercise together, which is called the bird dog. So it can help with our motor control, okay? All right, so let me show you guys how to do this. So for this exercise, we're gonna be on all fours, okay? So make sure your hand is right below your shoulder joint and your knee is below your hip joint. And before we start, we're gonna tighten our abs here, okay? And then we're gonna move left arm and right leg up. We're gonna make it parallel to the floor. So we're gonna, one motion, we're gonna move these two up. We're still tightening our abs. We're gonna slowly bring it down. So you have, when you're performing this, you have to make sure your pelvis is not rotating, you know? Not like this, not like that. Okay, so we have to have a controlled movement. So let me show you the opposite. I'm gonna bring this up and this leg up at the same time. Okay, so tighten our abs, bring it up, and slowly bring it up. Same thing here, bring it up, bringing it down. All right, so we can try to do this at home for like 10 times. And if you think it's easy, you can actually maintain that position on the top for a few more seconds. Okay. So now, go back. So we're gonna combine everything together, mobility, motor control, and strength. So we're gonna do some functional movement. So squats, right? Most of the time when we see people like, at the gym doing some squats with a lot of weights on their back here, right? With a barbell and a bunch of weights. But in fact, we're actually performing these kind of movement every single day. For example, sitting down to a chair, right? I'm sitting down, need to squat, going to the toilet, picking up a heavy item on the floor. We all do some sorts of squats. So it is actually really important for us to do the proper way in order to prevent injuries. I'm going to show you guys how. So we're going to make sure our feet is shoulder width apart, okay? All right, so I'm going to show you guys the side of that because that's the most important thing. So when we squat down, we're not going to bend from our knee right here. Okay, that's bad for your knee. We're actually going to hinge from your hips. So you're going to kind of imagine you have a chair behind you, and then you bring your butt out. Okay, make sure you're tightening your core over here too, and not overarching your back like this or rounding. Okay, let me show you again. Push back our hip. When we come up, we're going to use our glutes and push ourselves up, all the way up. So you can actually practice this every day. So when you're sitting down, try to do the proper way and back up. So it actually can protect your knee when you're doing this motion too. Instead of going forward, or also don't bring your knees in. So your knee should always be in this position, like kind of out a little bit, okay? Not in like this. All right. So now I'm gonna show you another functional movement, which is the lunges. So again, we can see people doing this at the gym, but we also do this at our house too, like picking something up or even doing some gardening, right? Or doing some house chores at a kneeling position. So I'm gonna show you guys this movement. So same thing. So we're gonna bring our leg forward, one leg forward, one leg back. And when we bend down, we want to kind of bend down using our muscles here instead of bringing your knee forward here. Okay, so we're gonna squat down, like a lunge down, and I'm gonna see our knees. It's gonna go into like a 90 degree angles here. And when we come up, we're gonna use our butt muscles to push ourselves up, down, and up. All right, make sure when you lunge, don't bring your knee way too forward. All right. Okay, let's go back to the. So as you can see from these two movements, we actually need a lot of mobility in different areas of our body, the hip, the knee, and the ankle. And you also need like proper strength and motor control in order to help you perform these movements properly, right? All right, so now I have good news for all of you. We are providing free functional movement screen and Y balance tests on November 7th. So again, it's free. All right, so what exactly is that? So functional movements screen, we're gonna have you perform 7 different movements. So these movements, we can actually allow us to know if there's any dysfunctions in your body in terms of mobility, strength, motor control. Again, those 3 key things. And for that Y balance test on the right side, so it actually looks into if there's any imbalances between your upper extremities and lower extremities. So these screens and tests have been backed by a lot of research, and it actually help identify if you have like a high risk of injury, especially for people who play sports. Okay. So again, this is suitable for everyone, but more tailored for athletes. So if you personally play any sports, it will be a really good test for you, or if you know anyone who play any sports or an athletes, let them know about this news, okay? All right, so I'm gonna show you guys how to sign up for the spots. All right, so I'm gonna have you just take a photo of this or just screenshot on your phone. You can see that website here, risingsunpt.wixsite.com/injury prevention. All right, when you get onto this website, you will actually see this screen over here. Reserve my spot, and then just type in your first name, last name, email address, and your phone number. All right, and then simply just select your contact preference, and then just submit, and then we will contact you shortly. So the assessment is actually an hour long. So it is a really, really detailed assessment, and it is pretty time consuming because we're actually having you perform some movement. So it's like a physical assessment. And with our eyes and our brain of our therapists, they can actually look into like a lot of like faulty movement that you're presenting. And then we also provide you like detailed feedback and also provide you guys potential services tailored to your needs and results. All right. And then don't forget to follow us on Instagram, Rising Sun PT, and our Facebook, Rising Sun Physical Therapy and Wellness. And do you guys have any questions?
I signed up for you have me on the list.
Okay. Did anyone call you back about it?
No.
All right. Here I signed up and have not received a confirmation email.
Okay. I'll let them know, okay? And if you guys mind, can you guys just message me on the chat box and write down your email so I can like take note of it, okay? Any other questions?
No, that's good.
All right. Okay, so I see Iris, you sent me your email. Kathleen, can you send me yours so I can contact you?
This has been very helpful. Thank you so much.
Yep, no problem.
Yeah, very good.
Thank you. All right. Any other questions? All right. Don't forget to.
Is it possible to is it possible to get a I think that's on a Saturday, right?
Yeah, it's on a Saturday.
Is it possible to get a spot late afternoon?
Afternoon, around what time?
Like 3:30.
3:30. I can let them know and see. Yeah. Okay.
Okay.
All right. So let all your friends know about this because this is something really rare that we give out and it's only limited.
Yeah, that's really good. I'll tell my friends about it.
All right. Thank you guys. All right. If there's no questions, this will be the end.
Thank you so much.
All right. Thank you guys for coming. Bye.
Bye.